Welcome to another episode in our series on COVID-19 Science in Context. I'm Stephen, and joining me this week is Professor Neil Ferguson. Have you seen anything in the data so far to indicate the path of the UK epidemic in the next few weeks and months?
Case numbers are still rising, as we expected them to with the new Delta variant. It should be said that the Alpha variant, the old Kent variant, is still in decline. We're still in absolute terms at very low numbers of hospitalisations and very low numbers of deaths, and that's good news. It implies that despite the change in variant, the vaccines are proving highly effective, particularly after people have received 2 doses.
The government is considering waiving the need to quarantine for travellers who have had 2 doses of a vaccine. What does the science tell us about this?
The effectiveness of 2 doses of vaccine preventing infection is, depending on the vaccine, somewhere between, we think, 80 and 90%. Even if you do get infected, first of all, you're much less likely to be severely ill, but you're also, and this is important for travel, much less likely to transmit, probably half as infectious as somebody who wasn't vaccinated. So overall, that leads to doubly vaccinated people, really only posing somewhere between 5 and 10% of the risk of importing a case than somebody who wasn't vaccinated. So in the sense that we are balancing risks versus benefits here, I think it's a sensible approach to move to loosening restrictions if people have had 2 vaccine doses.
Why has America been able to relax restrictions more quickly, and will they be hit by another wave?
Difficult to generalise about the whole of the United States, and it's a much larger country than any European country. From the UK perspective, if it hadn't been for the Delta variant, we would have been in a very good position. In the US, they mostly just still have the Alpha variant, and they're seeing clusters of transmission, but as you say, low numbers overall. They're also concerned about the risk Delta may pose to that. They don't have the same high levels of vaccine coverage across the board that the UK does. So there are some potential risks going into the autumn. And I know my US colleagues are very anxious to encourage people who haven't been vaccinated to take up the offer of highly effective vaccines as soon as possible.